Hello everyone. So welcome to Dr. Ankit Pharmacology series and I'm myself Dr. Ankit. So in this section let's discuss certain new drugs for coronavirus which causes a disease that is COVID-19. COVID-19 stands for corona, V for virus, I for infectious, D for disease, and 19 symbolize that it was appeared in year 2019. So let's discuss first that how this coronavirus infects a human cell. Okay, now this coronavirus is a member of a family known as SARS-CoV-2 family. So this is the first point I am marking, SARS-CoV-2 family. SARS stands for severe acute respiratory syndrome. CoV stands for coronavirus 2. Okay, now how it infects a human cell, as you can see in this diagram, this virus has some protein, spike protein, okay, S protein. Now this virus shape is looking like a crown. It's looking like a crown of a king. That is why it is known as coronavirus. Because of this spike protein, the shape is like a crown, hence it is known as coronavirus. Now it affects human cell. On human cell there are two receptors which are simultaneously required for the entry of coronavirus into the cell, into the human cell. The first receptor is ACE2 receptor. We will write one here, ACE2 enzyme receptor. A stands for angiotensin convertase enzyme 2 receptor. Okay, A stands for angiotensin 2 convertase enzyme. And second receptor we are seeing on human cell is TMP RSS. So TMP RSS stands for transmembrane, T for transmembrane protease. So TM stand for transmembrane protease serine precursor 2. Okay, so this is the full form of TMP RSS. Now this coronavirus attaches to these two receptors. These two receptors are required on human cell. Okay, these two receptors are required on human cell. With the help of these two receptors, it enters into the human cell, and this entry is known as membrane fusion and endocytosis. Now when it goes inside the cell, it is covered by an envelope. This envelope is made up of plasma membrane. So this plasma membrane containing a virus is known as endosome, and the pH in this endosome is acidic. You have to remember this point. So this endosome must have acidic pH. Now after this plasma membrane or the coating around the virus vanishes, it disappears. So this is known as uncoating of virus, and the single stranded RNA of a virus comes outside. So this SARS-CoV virus or coronavirus is a single-stranded RNA virus. Now this single-stranded RNA virus undergoes translation. Translation means synthesis of different proteins. And one very important protease is required, that is chymotrypsin-like protease. Okay, so chymotrypsin-like protease. So remember this word, I'm making a star. You have to remember this word. You have to remember this word endosome. You have to remember the words S protein and these two receptor, ACE2 receptor and TMP RSS2 receptor. Why? Because we have drug against them. Now when it undergoes into translation, it forms different proteins. Some proteins are non-structural proteins, no need to remember. But what you have to remember, it forms a protein known as RNA dependent RNA polymerase. So you have to remember this word, RNA dependent RNA polymerase. The function of RNA dependent RNA polymerase is to form single stranded RNA into multiple copies of another single stranded RNA. Okay, so this is by this enzyme. It forms multiple copies of single stranded RNA, but it forms multiple copies of single stranded RNA after entering into the nucleus. And to enter into the nucleus, it requires one channel known as important channel. So you have to remember this word, important channel, because we have a drug which will block this important channel. We will discuss that drug will be ivermectin. Okay, now when multiple copies of this single stranded RNA comes outside, it are formed, they come out of a nucleus, And coming out of the nucleus with non-structural protein, this virus will be assembled together and it will form a complete virus, SARS-CoV virus. And this SARS-CoV virus goes out of a cell known as exocytosis. So earlier it was endocytosis, now it is going out of a cell, it is known as exocytosis. And due to this multiple virus, these antigens are identified by our immunity like macrophages, and macrophages releases various cytokines like interleukin 6, TNF alpha, tumor necrosis factor alpha, VEGF. And due to this host cell, excessive host cell immunity, our surrounding tissues or organs will also get damaged. Hence, this SARS-CoV may cause mortality, and the major cause of mortality is lung failure or pulmonary failure, which will lead to ARDS. ARDS is acute respiratory distress syndrome. So if we have understood this whole cycle, I am repeating this cycle in just 1 minute. SARS-CoV virus, it has which protein? S protein. Which receptor on human cell is required? ACE2 or TMP-RSS2. Okay. It forms endosome with acidic pH. Then there is encoding of virus and translation by protease enzyme. Translation occurs by some protease enzyme. RNA dependent RNA polymerase is formed, which enters into the nucleus through important channel. Multiple copies will be produced. Virus will get assembled. It comes outside and our immunity will try to kill this virus, but this immunity will also kill surrounding cells, which will lead to organ damage. So if we have understood this cycle, now let's discuss certain drugs which are under trials for coronavirus. But remember, none of the drug has been approved by US FDA. FDA has not approved till now any drug for COVID-19. So let's make this diagram again. So if you remember the first part is the entry of virus. First part is the entry of virus. So let's inhibit this entry of virus. Okay. So the first drug, we have to remember 3 drugs in this: hydroxychloroquine, nefamostat, and umifinovir. Nefamostat is also a similar, it is also known as Camostat, and umifinol brand name is Arbidol. Now hydroxychloroquine inhibit the entry of virus into the cell. It acts on both ACE2 receptor and TMP-RSS2 receptor. How? We will discuss shortly. Nefamostat also blocks TMP-RSS2 receptor, and umifinol inhibits the interaction between S protein and TMP-RSS2 receptor. Okay, so these are the 3 drugs and we will discuss these drugs in detail shortly. Now when this virus has entered into the cell, we know it forms endosome, and endosome has which pH? Acidic pH. Again we will write hydroxychloroquine second time. Hydroxychloroquine rather increases the pH of endosome, it rather makes it alkaline. Hence endocytosis will not happen. Okay, so second mechanism. After this virus, we know this virus, it will produce, this virus will undergo translation by some protease. So we will have one drug that is protease inhibitor. So that protease inhibitor are HIV drugs. You can write like lopinavir, darunavir, and ritonavir. So these are protease inhibitor. Okay, so these drugs are protease inhibitor. Easy. So these drugs are protease inhibitors. So let's just wait for a moment. These drugs are protease inhibitor: lopinavir, darunavir, and ritonavir. Okay. Now let's move ahead. Now when this RNA dependent RNA polymerase is formed, this RNA dependent RNA polymerase, we know it enters into the nucleus by important channel. Now before it can enter into important channel, we will discuss certain drugs which will directly inhibit RNA dependent RNA polymerase. Okay, and these drugs are generally fake or analogs of purines and pyrimidines, like remdesivir, a very important drug for you. It has been approved in India. Galidesivir, these are fake adenosine. Ribavirin, fake guanosine. Favipiravir, the first drug approved in China, we will discuss that drug. It directly inhibits RNA polymerase. Merimipodib, it depletes or inhibits the synthesis of guanosine. Cytidine word is coming, so it's a fake cytidine analog. Now this RNA polymerase, we know fifth target, it enters into the nucleus with important channel, and the drug is ivermectin. Okay. Now when this virus comes outside, we know that our immunity acts against this virus and our organ gets damaged. So we give immunomodulators when the patient is symptomatic for coronavirus and the organs are getting damaged like ARDS. So we will reduce the immunity by immunomodulators like corticosteroids, hydroxychloroquine, again third time we are writing, tocilizumab and sarilumab, which will inhibit interleukin 6, bevacizumab, which will inhibit VEGF. So these are monoclonal antibody because they are ending with the word MAP. And we can also do plasma exchange, and we can directly remove these cytokines from the plasma. Okay. And these are the certain miscellaneous drugs which have a very complex mechanism of action. Need not to remember, just write for the reference only. Probably some of them will be approved. They are under the trial. Various anthelminthic drugs like niclosamide, emetine, ivermectin we have already discussed. Plitidepsin inhibit elongation factor required for the replication of RNA. Bemcentinib inhibit AXL kinase inhibitor, and rintatolimod inhibit toll-like receptor, which is present generally on our WBCs. Okay. Now let's discuss certain individual drugs which are important. We need not to discuss all the drugs. We just have to discuss very few drugs among this whole list. Okay. So the first drug, let's start with entry inhibitors. See this entry inhibitors. And in entry inhibitors, we have written three drugs, if you remember: hydroxychloroquine, nefamostat, and umifinovir. So let's discuss with entry inhibitors. Let's start with first entry inhibitors. Okay. So the first drug is hydroxychloroquine, and this is the drug you have to look for, and it is very important that you must remember about everything about the role of hydroxychloroquine in coronavirus infection. So this is the most important point you have to remember. Now what is hydroxychloroquine? It is a longer acting congener of chloroquine. So this is the first point. It's a longer acting congener of chloroquine. Okay. Now what is the mechanism of action? It has three mechanisms of action. It inhibits entry. It inhibits endocytosis by formation of endosome. And it also have immunomodulatory effect. Now let's see how. How it inhibits entry of the virus into the cell. It inhibits glycosylation of ACE2 receptor. If you remember, ACE2 receptor was present on human cell. So it inhibits glycosylation of ACE2 receptor, and it inhibits proteolysis of spike protein present on coronavirus. Okay. So by these two mechanisms, it inhibits entry. It inhibits endosome formation. Why? Because endosome was having acidic pH. It rather makes the pH alkaline. Okay. And lastly, it has immunomodulatory effect because it decreases the production of cytokines like interleukin 6, TNF alpha, etc. Now this hydroxychloroquine was the first approved drug worldwide for COVID-19. Okay. First drug. And in India also. But recent data by World Health Organization or WHO shows that it lacks effectiveness. Okay. So it's very unclear that is it a very effective drug in coronavirus? Still we don't know. Now what is the dose? The dose is in between a range of 400 to 800 milligram on the first day. On the first day we give twice a day as a loading dose. And after that, followed by this same dose is given once a week. And it is given orally. Now what are the other uses of hydroxychloroquine or chloroquine? Because of this immunomodulatory effect, chloroquine is used in various autoimmune disease or hypersensitivity, which are known as when the immunity is acting excessively. It is used in hyperimmune disease like DLE, okay, drug-induced SLE, rheumatoid arthritis, infectious mononucleosis, and skin eruption due to photosensitivity, photomorphic light eruption. Chloroquine is also a protozoal drug. We all know it is used in malaria, but apart from malaria, it is also used in giardiasis and hepatic amoebiasis. Okay. Now let's talk about certain properties of hydroxychloroquine. It has highest volume of distribution among all known drugs, around 15,000 liters. It means it deposits in various organs. Okay. And as it deposits in various organs, it produces toxicity in all organs. But notable side effect you have to remember is that in eye, it causes a retinal damage known as bullseye retinopathy. Now, which will lead to blindness? Now, what is bullseye retinopathy? If you see retina from the front, this is retina, you are doing fundoscopy, and in between we have this macula where image is formed. This chloroquine deposits on retina just like concentric ring. This is deposition of chloroquine on retina. Now it is looking like a shooting board. That shooting board is known as bullseye. Hence it causes bullseye retinopathy. It leads to permanent blindness. It's a very dangerous effect. It also leads to deposition on cornea and lens, which will lead to blindness. On heart, a very peculiar side effect you have to remember, it causes QT prolongation, QT interval prolongation, which increases the excitability of heart, and it will lead to fatal ventricular fibrillation like torsades de pointes. It increases the risk of torsades de pointes. Hence, this chloroquine should be avoided with other drugs which also lead to torsades de pointes or QT prolongation. A very notable example you have to remember is azithromycin. Because some countries said that use this hydroxychloroquine with azithromycin. But the problem when we are using with azithromycin, it will lead to dangerous ventricular fibrillation and people may die suddenly. Okay, so now the use is generally avoided. We generally say that don't use it. Now the next drug, if you talk, so now the next drug is nefamostat or camostat. Now nefamostat or camostat is a serine protease inhibitor. Okay, so it's a protease inhibitor. And remember that this TMP RSS2, I have already told you that it's a kind of protease enzyme. So it's a kind of protease. Here P word stands for protease and it is a protease inhibitor. Now this drug has been recently been introduced in India and it has entered into phase 2 trial in India by a very famous company Sun Pharma. But earlier this drug was approved for pancreatitis in Japan, dengue hemorrhagic fever, and during hemodialysis it is given to prevent clotting of blood because it inhibits fibrin formation. We know that fibrin is produced from fibrinogen. So fibrinogen forms fibrin and fibrin blocks a blood vessel. To convert fibrinogen into fibrin, we require a protease enzyme. And we know that this nefamostat is a protease inhibitor. So the problem is if the fibrin is not produced, it will lead to bleeding because the function of fibrin is to stop bleeding. And this drug is given intravenously. Okay. Now the next drug is umifinovir. The brand name is Arbidol. Now this drug inhibits the fusion of viral spike protein with the human TMP-RSS2 receptor. It is under clinical trial for COVID-19. It has been approved in China and Russia and it's a very famous drug for influenza virus, seasonal influenza virus, but in India and America no role has been found. Okay, so it is under trial for COVID-19. Now let's come to the drugs which are RNA polymerase inhibitor. Now we know that in coronavirus a single stranded RNA gets converted into another single stranded RNA, multiple copies. The function to convert one single stranded RNA into another single stranded RNA is the function of RNA polymerase. Now can we call this RNA polymerase as RNA dependent RNA polymerase? Because it is acting on single stranded RNA and it is producing single stranded RNA multiple copies. We know that in our humans DNA is converted into RNA. So we humans have DNA dependent RNA polymerase. But this virus has RNA dependent RNA polymerase. Okay. So this RNA will require various purines and pyrimidines like adenosine, guanine for the production of other copies of RNA. So we have made certain drugs which are RNA polymerase inhibitor. A very important drug you have to remember is remdesivir. It's an important drug because recently this remdesivir has been approved in India. Now this remdesivir and a similar drug galidesivir approved in Russia, it is a fake adenosine analog. Okay, so its structure is just like an adenosine. So this RNA polymerase will not able to distinguish between a normal adenosine and remdesivir. So a defective RNA will be produced. So it's a kind of a competitive inhibitor of RNA polymerase. Okay, so there will be defective RNA synthesis by RNA polymerase. These drugs are given IV. They are CYP inhibitor. They decrease the metabolism of other drug, and the important point is they are prodrugs. Their side effect is they are very dangerous drug, nephrotoxic, hepatotoxic, and bone marrow suppression. Now the next drug is ribavirin, a very old drug and a famous drug for various RNA virus. So this drug is under trial for COVID-19. Now this ribavirin is a fake guanine analog. Okay. It has, so again it will inhibit RNA polymerase, because RNA polymerase will not able to distinguish between normal guanine and this fake guanine. Now this ribavirin has earlier been approved for hepatitis C virus, it was given orally, respiratory syncytial virus, pneumonias, it was given inhalationally, and various hemorrhagic fevers like Lassa fever, Zika virus, Ebola virus, it has been tried. Now the side effect is hemolytic anemia, hepatotoxic, and teratogenicity. Need not to remember the side effects. Now favipiravir, it directly binds to RNA polymerase and inhibits the action. Okay, and it was the first drug approved for COVID-19 in China and worldwide. Okay, and it recently been approved for influenza in China as well, favipiravir, but it is only approved in China. Hydroxycytidine, fake cytidine analog, merimipodib, it inhibits guanine synthesis by inhibiting IMPD enzyme. IMPD stands for inosine monophosphate dehydrogenase enzyme, which is a de novo, which is required for synthesis of guanine inside the cell. Okay, so just remember the names, more than enough. Now a drug which inhibits the entry of single-stranded RNA into the nucleus. If you remember, this single-stranded RNA enters into the nucleus. Agreed? To enter into the nucleus, it requires importin channel. So let's inhibit this importin channel by a drug, similar drug, I for importin, I for ivermectin. Okay, so it inhibits the entry of RNA polymerase into the nucleus. Now this ivermectin is also a very famous anti-helminthic drug for worm infestation. As an anti-helminthic drug, it has different mechanism of action. It inhibits open some glutamate chloride channel, which will lead to flaccid paralysis of helminthic, and helminthic they die. It's a drug of choice for strongyloid, onchocerca. Onchocerca causes river blindness, cutaneous larva migraine, lymphatic filariasis, and it is the only oral drug we have for scabies infection as well. So it has multiple uses. Okay, let's talk about certain immunomodulators which reduces the immunity, because when immunity will act, it will kill the virus, but it will also kill the normal body cells, like pneumonia will happen, like ARDS will happen. So these drugs are only given for symptomatic patient who are having some evidence of organ damage. They are never given for prophylaxis. Okay, now if you talk about for the first drug is corticosteroid. The corticosteroid, they are indicated in severe ARDS, acute respiratory distress syndrome, or if there is septic shock, because that coronavirus may lead to secondary opportunistic infection as well, so it may lead to septic shock. Tocilizumab and sarilumab, now these drugs, let's make it Sari, SARILUMAB, sarilumab. So I'll write it again, sarilumab. Now these drugs are ending with the word MAB. Here MAB word stands for monoclonal antibody, and these two monoclonal antibody blocks in interleukin 6, which you have to remember. So these are drugs which are given only if the patient is having some evidence of organ damage like ARDS, acute respiratory distress syndrome. But earlier these two drugs have been also approved for various indication. As this interleukin 6 is a type of cytokine, so this tocilizumab is also been approved for cytokine release syndrome, to block this cytokine, rheumatoid arthritis, and we know that cytokine causes inflammation, so various inflammatory disease like arthritis and Castleman disease, they have been approved. Sarilumab, this question has also been asked, it has recently been approved for rheumatoid arthritis. Now these drugs are only given in cases of COVID-19 patient if they are symptomatic. But the very important point you have to remember is none of the above drug, what we have learned till now, has been approved by American FDA, Food and Drug Administration. So no drug till now has been officially approved by US FDA. So you have to remember this part. So we are still seeking, we are still exploring the treatment option for COVID-19. So this is all about, you have to remember about COVID-19. So thank you very much. Keep learning. Best wishes.